2004 when it was declared by former President Gloria Macapagal Arroyo that March 10 is to be known as the Araw ng mga Buntis. The Philippine Obstetrical and Gynecological Society wanted to dedicate this day to all pregnant women by bringing public awareness to this long neglected sector of our society. With that being said, today's episode is all about prenatal care, dedicated not only to the women expecting but also to everyone who wants to learn more about women's health. I am Jed Liano, welcoming you to another episode of Lifeline, where we improve our lives by feeding our minds. Joining us for today's episode is Dr. Anne Catherine A. Castro, our maternal fetal medicine specialist, along with Dr. Criscan Noel Raimundo, a maternal fetal medicine fellow in training. Hello po, Doctoras. Welcome to Lifeline. Kamusta naman po kayo ngayong araw na to?
So I'm good. Thank you very much for inviting us today. It's my first time on your show.
Yes.
So happy to be an instrument in promoting maternal and fetal healthcare.
Yes.
Same here. It's really an honor to be invited in this kind of event so we could promote maternal and fetal medicine to everyone.
Yes, and it really is an honor for you both to be here with us today. And that's right, we are here to promote all the things that people should know, especially all about prenatal care. So, with that being said, I'm sure our audience is really looking forward to learning more about prenatal care, especially, of course, mothers or newbie moms out there. So, to all our viewers, I hope you guys are tuning in here in our episode. So, now let's dive right into our discussion. So, for Dr. Raimundo, how would you define prenatal care?
So, prenatal care is an observation and assessment of women starting from conception to delivery and to labor and delivery. So, the main goal of prenatal care is to ensure a healthy delivery for our newborn. And to minimize any maternal risks. So, usually, what we want to do in prenatal care is to accurately know the
Mm-hmm.
gestational age or the age of the pregnancy and to make sure that there are no other fetal or maternal risks that could promote morbidity and mortality for both the mother and the baby.
Yes. So, ngayon pa lang nakita na natin yung importance of prenatal care so that we could avoid the risk, kumbaga, of having diseases or kumbaga furthering yung mga hindi natin, yung mga ayaw natin when it comes to becoming pregnant. So, for Dr. Castro naman, so how often should an expecting mother go in for a checkup?
So it would really depend if the mother, the pregnant patient is high risk or low risk. But in general, you would go monthly for a prenatal checkup until you're 28 weeks or 7 months. And then every 2 weeks until you're 36 weeks and weekly thereafter until delivery. But of course, if the patient's high risk, you classify the mother as high risk, then it would be a little more frequent than that.
Yes, so thank you for that, Doctora. So, ngayon naman, for Doctora Raimundo again, what are the common laboratory tests being done to check the overall health of the baby and the mother?
So first and foremost, in the very first prenatal checkup, we already request a battery of tests. So first would be we request a complete blood count to make sure that the mother is not anemic throughout
Mm-hmm.
pregnancy. We also request some tests to check for any infections present, such as urinalysis. We check for hepatitis, syphilis. We also check for the blood type of the mother. We also want to screen for comorbidities in pregnancy, such as diabetes. That's why in the first checkup, we also request for fasting blood glucose. Aside from lab tests, we also want to regularly check for the well-being of the baby. So we also request for ultrasound.
Okay po. So, makikita talaga natin that there are really a lot of tests that a mother should go through when once na nagkakaroon sa ng pregnancy. So, a follow-up lang po. Are these tests available in the UST hospital?
Yes, so all these laboratory tests are available here in our institution. The laboratory is open 24 hours.
Yes.
And we also have our OB-GYN ultrasound unit, which is also open from Monday to Saturday. So all the pregnant mothers could have their ultrasound done here.
It's really nice that we have these tests or laboratories present here in university in higher in our university. So to all the new mothers out there, you guys can check UST Hospital if you want to undergo these laboratory tests. So now for Dr. Ann Castro, what are the signs that doctors look out for before declaring a pregnancy a high risk pregnancy, since na-mention nyo nga po kanina yung if we classify a mother as as a high risk.
Okay, so we classify pregnant patients as higher risk if, say, for the mother has comorbids before even getting pregnant. She already has a heart disease, say for example, heart disease, lung disease, like asthma,
Mhm.
or any other comorbidities. So that's one. And another is a fetal condition. So if there's an abnormality, let's for the fetus, that would already also classify the pregnancy as high risk. But um, another thing is, during every prenatal checkup, we would also check for the 10 danger signs of pregnancy. So maybe we check for hypertension, signs of hypertension or preeclampsia, such as having headache, dizziness, blurring of vision, chest or nape pain. So maybe check your blood pressure, and these are signs that you're having maybe preeclampsia, and major complication is like eclampsia. So these are signs that you're about to have a seizure episode.
Yes.
Another thing that we also check is, like Dr. Kriska has said, there are laboratories to check for infection. So we also check for like dysuria or mahapde, yung pag-ihi, or urinary frequency, or hematuria or blood in the urine, because these are signs of urinary tract infection. Another thing is if the mother has fever also. So but in case it is not treated, then you can have other danger signs like watery discharge, vaginal discharge. So maybe the bag of waters is already ruptured, or the patient went into preterm labor if you have missed that infection. Also, a danger sign is decreased fetal movement. But maybe the fetus is just asleep, as most of the time the fetus is. But if the mother is with the fetus 24/7, but if the mother complains of a decreased fetal movement, it's good practice, or it's better to check it, and having any one of these danger signs, you tell your patient to go immediately to the emergency room to be checked.
Okay, thank you for that, Doc. So you heard that right, guys. So there are a lot of things that we really have to check once we undergo pregnancy. So it's really important that we check ourselves and we go under these tests and laboratory. So pag nagkakaroon na tayo ng mga ganitong klaseng experiences while we are in while having or being pregnant, it's important na magpa-check up na tayo. So for now, for Dr. Raimundo, what is the importance of paternal role during prenatal care? And can you mention some important advice for the fathers as our female warriors go through their pregnancy?
So usually the importance of having the support of the father is important because they should provide moral, emotional, and physical support for the
Yes.
pregnant mother. So from preconception to prenatally, even during labor and delivery, their presence is vital. So there are actually studies that show that the presence and the support of the father would decrease the incidence of premature labor and delivery and even fetal mortality. So my advice for them is every time the mother goes for prenatal checkup, it would be better to for the father to also be there. So
Yes.
personally I'd like it if the father would also be there when I
Present.
examine the mother. I let the father also hear the fetal heartbeat, and I want him to also listen to the advice, like what Dr. Castro mentioned, the 10 danger signs of pregnancy. So at least the father would be there also to watch over the pregnancy. The mother shouldn't feel alone in this 9 months of
Yes.
carrying the baby. So the mere fact that she has her partner with her would really be helpful. So there are also some institutions in our hospital wherein we already allow the father to be with the mother during the delivery. So I'm sure that his support would be beneficial for both the mother and the better outcome of the baby.
Thank you so much for that. So bottom line, to all the fathers and daddies out there, be there for your wives and for your wives who are carrying your baby, because it's really important that we have to be there for them, kasi gaya nga nasabi ni Doktora, hindi joke yung 9 months of going through a lot of changes in their lives. So it's really important that we have to be there for them. And that's it for this segment. Thank you so much, Doctorias, for answering our queries regarding this topic. So tune in for the next segment, because once we return, we'll be performing a round of mythical operation and discussing the araw ng mga buntis.
The University of Santo Tomas Hospital, we prioritize the health and well-being of women at every stage of our comprehensive obstetrics and gynecologic services are designed to empower you to take control of your reproductive health journey.
State-of-the-art facilities. Our clinic is equipped with the latest technology and state-of-the-art facilities to provide you with the most advanced diagnostic and treatment options available. Patient-centered approach. We understand that every woman is unique, which is why we take a patient-centered approach to care. We listen to your concerns, respect your preferences, and tailor our services to meet your individual needs. Comprehensive services. From routine gynecologic exams and family planning services to prenatal care, childbirth, and menopause management, we offer a full spectrum of services to address all of your reproductive health needs under one roof. Our team of obstetricians, gynecologists, and healthcare professionals are committed to providing compassionate and personalized care. Experience the difference here at UST Hospital. Whether you're in need of routine gynecologic care, prenatal services, or specialized treatment, we are here to support you every step of the way.
Hello and welcome back to Lifeline. Previously, our lovely guests, Dr. Anne Catherine A. Castro and Dr. Criska Noel Raimundo, helped us answer some of the common general questions regarding prenatal care. Now, Doctoras, for this next segment, we will we will play or perform mythical operation where we dissect facts from misinformation. So for the next few questions, we'll recite some statements and you'll welcome to tell us whether it is a fact or a myth. So let's begin. Is it a fact or a myth? The abstinence from alcohol consumption reduces the risk of SIDS.
Surprisingly, this is a fact. There are some studies which show that alcohol intake, especially in the first trimester or in the early part of pregnancy, would actually cause an increased risk. Actually, based on that study, there's a 16% risk of SIDS in mothers who take alcohol, and even actually if there's drug intake during the first trimester. So aside from SIDS, there are actually a lot of adverse effects of alcohol intake, such as a lot of congenital anomalies and increased risk of preterm and hypertension in pregnancy. So we really don't advise the intake of alcohol during pregnancy.
Alright, so next man po, is it a fact or a myth a non-pregnant woman intaking prenatal vitamins promotes conception?
Well, this is actually a myth. While prenatal multivitamins is important during pregnancy, it's not a magical solution for conception. What we do is we optimize that non-pregnant patient. Let's say she has comorbidities, you treat all the comorbidities, and of course promote healthy lifestyle, diet, regular exercise, and again optimization of the well-being of that patient.
Right, thank you for that. Next, our last one. Is it a fact or a myth a pregnant mother's diet will affect her baby's eating habits?
This is actually partly a myth because I think the diet of the mother prenatally would not really affect the habits or the eating habits of the mother of the baby. However, it would affect the overall health of the baby in terms of maybe an increased fat or sugar in the mother's diet would increase the risk of diabetes. So this would cause some comorbidities in the baby. But based on studies, usually the eating habits of the baby once delivered is not affected by it.
All right, thank you so much for that. And that's it, guys. I hope you guys were listening to our doctors present here today and you were able to identify which are the facts or the myths. So thank you so much again, doctors, for helping us dissect these facts. But moving on, in relation to our topic about prenatal care, let us talk about what's about to come this March 10th, which is the Araw ng mga Buntis or Buntis Day. So this next pair of questions are for the both of you naman na po. So this year marks the 20th anniversary of the declaration of Araw ng mga Buntis. How was this day help our patients, doctors, and society, especially in your profession?
So, the araw ng mga buntis, well, helps in awareness, promoting awareness and promoting healthcare. So, for the patients, early prenatal checkup, for the doctors, identifying those at risk, classifying them as high risk and or low risk, and giving early checkup. I mean, early treatment for those that are classified as high risk. And as a society, we promote like community involvement in these
Yes.
in promoting maternal fetal healthcare.
So, the Araw ng mga Buntis is really to celebrate self-empowerment for our pregnant mothers. It's also, just like what Doctora said, self-awareness and to promote the importance of prenatal care and to promote the importance of identifying maternal risks throughout pregnancy. So, this day is culmination of or a celebration of the entirety of pregnancy. So we celebrate mothers and also not just the mothers but also the support system of the mothers during this day.
Thank you for those, Doc. So yun guys, diba? This day, it's really all about empowerment. Being able to to give honor and to celebrate women in terms of becoming pregnant because gaya nga ng sabi natin, it's not easy dun sa 9 months na yon, and it's really to give honor and to empower every woman who's going through this process or this life cycle. So, now that we're celebrating Araw ng mga Buntis, what would be your message to all the pregnant women out there, and also to, of course, the supporting system of these mothers?
Okay, so congratulations to all pregnant
Yes.
moms. And you need not be alone in your 9-month journey. And we are together with the fathers, your relatives, the family, we are your partners for promoting a healthy pregnancy. And of course, our optimal goal is to deliver, for you to deliver safely and to have a good outcome for your baby.
For me, I think the most important topic to really discuss during pregnancy is the importance of prenatal care. So that's why I'm happy that this is the subject
Yes.
of this, because it's really important to take care of the mother from start of from the first trimester up until the delivery, because this is the time wherein we are able to emphasize the importance of all the aspects or the factors that affect the pregnancy, from the importance of paternal care,
Yes.
the importance of diet, the importance of the right scheduling or the right follow up, and the lab test and ultrasound. So during this time, it's really important to really take care of the pregnancy, and if there are any problems, I would just like to emphasize that the doctors or the healthcare team surrounding your pregnancy is here. So if there are any problems or if you have any complaints, it's really important to consult your doctor.
Yes. So thank you so much for those very inspiring words to all our mothers, and of course the support system of all of these mothers. So you heard that right here, guys. It's really important that we see the importance of prenatal care, and that we celebrate and we empower these women who go through these such process in life. Kasi these mothers bring new life into this world, and it's really a gift and a blessing for us to be able to celebrate and to really welcome these new life into this world. So we'd like to thank you, Doctoras, for taking the time to answer the questions and in turn help educate us when it comes to prenatal care. As we celebrate Araw ng mga Buntis, we have the privilege of reminding ourselves of the female warriors that are our mothers. We hope today's episode has spread awareness on the importance of receiving medical care during pregnancy, because with accessible and affordable prenatal care, we can ensure to provide the best possible future for the next generation. Always feel the roar by following us on our socials at UST Tiger TV and at UST Tiger Radio. Once again, I am Jed Liano, and this has been Lifeline, where we improve our lives by feeding our minds.